Good afternoon, everybody. Today is Friday, April 24th. I've got to go back and check the calendar because I'm losing track of days today. Another episode of Sheltering with the Supes. We're here with Supervisor Virginia Bass. Hey, hi, Supervisor Bass. How are you doing today?
Pretty good. I actually have to remind myself that it's Friday. So I can't believe how hard it is to keep track. So yeah,
Yes.
I totally hear you. But good today. It's a sunny day, and you got to be thankful for that.
Yeah, hopefully it'll last into the weekend. That would be nice.
That does
Uh,
sound like it.
so we wanted to start off a little bit with kind of talking about the public dialogue that happened last night with the sheriff and the health officer and Jeremy from public health. Did you get a chance to watch the dialogue, and can you tell us some of the kind of takeaways from it?
Yeah, it's very interesting. It was nice to see Josh Ennis, I believe,
There you
that's
go.
the
Josh.
deputy.
Yep.
Yeah.
Had the wrong
Um,
name.
Yeah, but it's nice to see some other faces, and he's an epidemiologist. I mean, he has specialized knowledge, which is something that's really helpful when people are presenting graphs and charts, because most of us can't really decipher what does this really mean. So he did the best he could to be really descriptive of a very challenging situation, and what I took away from that is we were shown there's a good best case scenario, stay sheltering in place, carry it out for a very long period of time, you'll have fewer deaths. Go back to what we were doing in the past and open everything up at one time immediately, and you're going to have a much worse picture, and it would happen much more quickly, if that makes sense.
Yeah.
And so I think it gave people a better understanding of, it's like, okay, if it happens that fast, we don't have the hospital beds to take care of people. Because if there's 188 deaths, there's a whole other, there's a whole lot more, there's more beds that are needed. And it was just, I think a reminder, though, that, you would look at the worst case scenario and what would be considered the best case scenario. And in reality, what we are trying to do is weave our way through, what works for the community as a whole. And this is like, it feels like a big experiment, but we do have some, very talented people who are working for us and on our side. And, but for me as a, just a community member, I wish we were able to talk a little more about what it would look like to open things up.
Mm-hmm.
But at the same time, I think we made it very clear that, like the mask order that just went into place, that's one of the first steps we have to do in order to even think about opening things up more.
Yeah, so can you tell us a little bit more about the mask order? I think it was just went into effect this morning, 12:01. Can you tell us about Dr. Frankovich's mask order and some of the reasoning behind that?
I'll do my best, and this is
Okay.
if I put it on, you can hear what I say. I think the masks aren't too, how do I say it? I think that's just, to me, it provides extra layers of protection between people. It's not necessarily that wearing a mask is going to keep you from, coming in contact, but if you sneeze and you're wearing a mask, it's less likely for you to infect somebody else. So when you've got people wearing their masks and interacting to some extent, I think it just really slows the transmission rate. And people are having a hard time getting used to it today. I've watched several people struggle in not wanting to put their masks on when they go into businesses. That when you leave your house and you're going to do essential business, you need to put your mask on before you go into a place where other people are.
Yeah.
Or say you're in a parking lot on the way into the grocery store. You need to put it on there because it's really hard. You're likely to pass someone within 6 feet. You can take a walk outside and you don't have to wear it unless you're in a high area where you're going to pass somebody, within that distance. So it's not like you have to wear it all the time. Some people are really, really upset about it. We've seen protests across the country and some, not so far from us. But, what I've been telling people is like, isn't it a small price to pay to wear one of these if we can start getting the economy kind of moving forward again? And that's the way I see this. It's it's might be an inconvenience, but I think it's a really small one. And people keep asking, what's the enforcement mechanism? And I think what I tell people, well, actually, I had a few people call me. It's like, well, what if I don't do it? Well, it's like, that's your choice, but there is going to be enforcement to some extent. First it's going to be educational, but you're going to have people who are absolutely going to defy it all the way through. And then I think we're going to probably see some other types of enforcement. What the sheriff has exactly planned, he would rather see people comply, just comply without having to cite people and, heaven's sake, you could take them to jail, I suppose. People were really going all out on Facebook with some of their thoughts of what could happen. And it's like, I don't think that's really going to happen, but just wear the mask.
Yeah, just listening to the sheriff, I don't think he wants to turn into, the mask police, or have people, calling in because other people are, not wearing their mask, and in kind of low risk situations. Like you said, he wants to take more of an educational approach for it. I've heard approach to it. I've heard him say, but if there are people who are, endangering public safety, then that's or the public health of others, I think that's something that that he would want to hear about. So you mentioned. Oh, go ahead.
No, I said you're exactly right. Someone who's just defiant just for the sake of being defiant is that's a different kind of person than just a regular person who just needs to really be better educated on it.
Yeah. So you mentioned a little bit about how you would like to talk more about reopening the economy and the things that are needed. Are we moving forward with reopening the economy, or is the facial mask order or facial covering order kind of part of that?
I think it's absolutely part of that. It's basically seen in many communities as the first step in even thinking about changing the stay-at-home orders or shelter-in-place orders. And if people are really compliant with that, I think it will be much easier as we move forward to see some other restrictions lift. However, if they're not going to be compliant with the mask order, I wouldn't be surprised if we find ourselves, with no lifted restrictions, if you know what I mean. It's kind of like, the mass will be affected by the few who defiantly disobey, basically speaking. So I would just say, if you have friends who think they shouldn't mask up, just let them know, you're the reason that we're slowing down moving forward. That sounds awful, doesn't it? But that's how I see it. And I don't have a problem telling somebody that.
Yeah. And I think in the background of all this, the state's shelter-in-place order, the governor's shelter-in-place order, is still in effect. And so, if Humboldt County were to go in a different direction, we would be one of the few counties to kind of do that, and it would be kind of in conflict with the state and the governor's shelter-in-place order, and that's something that I think that we have to keep in mind. So from what you're hearing, I've seen some polls out throughout the country about social distancing measures. How are people feeling about the social distancing measures, and what should they keep in mind as they consider going out for essential services and things?
Well, it's something certainly to get used to. Different stores are having different methods. I think Safeway has the one way, the arrows going up and down the aisles, and people aren't really paying attention to that because they haven't done it before. But I think as time goes on, we start standing further away from somebody. It's almost becoming kind of normal, which I didn't think that was going to happen, but it is. It's like, it's not that much different. When you look at bigger events coming in the future, I can't imagine what it would be to be in a concert in the Bay Area and do people 6 feet apart in line. You'd have the line going literally for miles, right? Mm-hmm. So I don't know how long. I mean, it's not always going to be effective, but I think in times, like the other day, I was going to order a coffee and I was looking at the menu and I realized I was too close. And so it's like, whoa, I need to back up. And, you know, it's being self-aware. And yesterday I went grocery shopping and I recognized 8 sets of eyes over their masks, and everybody was, you know, behaving like they're supposed to. And I was really actually quite proud of our community. I think people really want to do the right thing, and they want to help move the community forward. It's just, it's hard sometimes for people to accept that certain things are just not palatable, but you have to do them.
Yeah. Go ahead.
No, I was just going to mention other counties and the governor's order, and because I was going round and round with this, because I'm going, well, so-and-so is doing this and so-and-so is doing this. And I thought it was really useful, you know, when the sheriff, we were talking, and it's like, you know, local communities can be more strict than the governor's order, but you can't be less restrictive, right?
Right.
And so counties that have so far, like in Ventura County, as an example, they have opened up, you know, the golf and a few other things, but they also were more restrictive because they had like closed off beaches. But by the end of what they're, you know, the little change they made, they still fell within the governor's directive, and the governor actually signed off on theirs. So I think, you know, we need to look at others who might be making changes, but then follow kind of their examples of or best practices and how to do that.
Interesting. Yeah, this is, you know, like you said, this is our first time kind of going through this, and a lot of this is.
Hope we don't have to do it a second time.
Hopefully we don't have to do it a second time. I would rather not see this happen again, but we're kind of, you know, like you said, navigating this as much as we can with all these issues that are new to us and to everybody.
Right.
Well, you know, so I think the kind of big takeaways from this and the dialogue last night and the recent orders are, you know, it looks like we are moving forward. We're trying to get parts of the economy open. There are some things that we're going to have to sacrifice.
No, have a crash, or okay, he's gone.
No, I think your cat has something to say about it too. I think your cat might want to reopen too.
He'd like us to get out of the house.
Get out of the house, but be safe at the same time, right?
Yeah, and you know, people need to realize when we open it back up to an extent, we will see more people get sick again.
Yeah.
And if we open it too soon, I mean, we could likely end up being back in a shelter-in-place order if we don't do it right.
Yeah.
So that's why it's important for people to have patience. And I know it's hard because people's businesses are suffering, people's mental state is suffering. It's really, it's not a picnic for anybody.
Yeah. Well, hopefully the sunshine this weekend can help lift our spirits a little bit, and we can get out and, you know, still stay safe, get some sun, get active, and prepare for the next thing.
That's true.
Yeah.
And you know, we are a strong, resilient community, and we will be just fine.
Yeah. Okay. Well, thanks for taking some time today, Supervisor Bass. I appreciate it. We'll talk to you soon. Stay safe.
Is that okay? Bye.
Bye-bye.